name is Marita Hill, and I'm in a speech class at Austin Community College. I'm going to do a persuasive speech on why use hospice sooner than later. And to get started, I would like to read a quote to you here from Mr. Levy. It says, "If we know that pain and suffering can be alleviated and do nothing about it, then we ourselves become the tormentor." This right here, I'm going to pull this off because I'm going to pass it around, but I'd like to read you a few things off of this. Most hospice companies, and the one that I'm representing is AMED Community Hospice, has a 2-hour response time. So if you have somebody that you've decided to put on hospice, there's a 2-hour response time. Patients are admitted 24/7, 365 days a year. We have a certified nurse's aide that comes out 5 days a week. And then the nurse will come out twice a week if there's more that is needed. Of course, we can do that. There is no DNR that is required. Most hospice companies require that you sign a DNR, which means, do not resuscitate. And then they also will give you a special mattress because most of these patients are to the point where they're bedridden and laying on one side, and they have an air mattress that the air moves. Our company will aggressively treat wounds. When a patient lays, a wound can come up, and so they'll aggressively treat wounds. They provide medication, pain medication, that is for the end-of-life diagnosis. And if they're already on medications too, like if they have thyroid problems, they want to continue that, and it's already been issued by a doctor, they'll continue those things too. The other thing is they'll provide adult briefs, which can get very expensive. You do 2 or 3 a day, kind of goes from there. And they'll do nutritional supplies if you have a G-tube. Their medication management, making sure that somebody's getting their medication at the right time so they don't get out of control pain. However, if a patient does get out of control in pain, Medicare will pay for a nurse to sit at the bedside for 3 days, 24 hours for those 3 days. And if it's still not under control, they can reinsert for another 3 days. Now, the reason, I'm going to go ahead and pass this around, let you finish with those. The other reason for hospice sooner than later is a lot of people wait till their pain is, way out of control and they're dying, and it's 2 weeks and they're going to be dead, so they put them on hospice. And the reason why I think that somebody should be put on hospice sooner than later, if they have a end-of-life diagnosis and they've done everything that they can, I don't think they should wait until they're 2 weeks to dying, because their quality of life can be much better in that last 6 months. And I'm going to go over 4 topics that I think would be the reasons why. And these are some of the 4 needs that I think are the most. One is the physical need. The other one is the social need, emotional need, and the spiritual need. And sometimes it takes a while to get through all of these needs. Let's start with the pain need. Sometimes it takes the right pain medication to find out it works for the patient. There's methadone. Not only that, the process of going through, is it okay for me to take these heavy type drugs? And to find what works. And then the next one is the social need. The patients probably, they're slowing down a lot. They used to do things they can't do, maybe because of pain medication, or can't get out of bed. Maybe they can't talk. But they can still have their family around, talk about the good old times. The other thing is when should I stop eating? When do I stop drinking? All of these social needs that have to do with the patient and all these questions can come up in the mind, and an RN can be there to direct the family through these things. It's okay not to eat. If the patient doesn't ask for food, it's okay. If they don't ask for water, that's okay, because sometimes that can prolong death. And remember, hospice is for somebody who has an end-of-life diagnosis and has done everything they can do to get better. And now this is it. So it's not that we're killing the patient. We're just putting them and making their life comfortable. The last 6 months, the last year. And actually say patients who go on hospice actually live longer than patients that don't use hospice. And the reason why is because sometimes they don't do all this chemo at the end and all this last-ditch effort that kills the body quicker. And so what they do is they decide they're going to have a good quality of life at the last 6 months, whatever pain medications I have to take. And actually that leads me to the emotional needs. And these emotional needs, again, not only just as the patient, but the family. And so the patient may go through some isolation situations. The last I hurt so-and-so, going through, you know, some grievances, you know, to get things out and what to say and how to say it. And that's the patient, because the patient needs to go through those emotional processes. And then that pretty much leads us to a spiritual process. Every hospice company has a chaplain that is versed in every religion, and they can work with their own chaplain or their own pastor or whatever they want to call it to help them walk through the spiritual process. And so, does anybody have any questions today?
Yeah.
It is a benefit paid for by Medicare. Okay.
So it's paid by government?
Yes, it's paid by Medicare as long as you're on Medicare, and it doesn't matter what age. Most actually insurance companies pay for hospice also.
Transportation?
You don't need transportation because you're usually typically at home or in a facility.
Now, what if you don't have a place to stay? Do they provide a place?
Typically, that would be in the home, but if you want to go to a facility, there are Medicaid facilities for people who are not on Medicare, and then Medicare pays for certain facilities.
So the company itself has places where they...
It depends on where we're at, yes. We do contracts with what they call skilled facility places, like nursing homes.
Wow.
And if you wanted to use AMED, then where we had a contract, we would say, well, let's move there if you want to go to a facility. Some people don't have a home where they can set somebody in.
Now, there won't be no debt after this, let's say, after they pass on.
Right, there's
It
not
doesn't
with
get
insurance.
left with the family.
No.